Assalamu alaikum. On behalf of Ahsan Academy, let me discuss today on the anatomy of fascial spaces in the neck. Let us fix the objective first. The first objective we'll discuss is the name of the clinically significant spaces in the neck and their position of those spaces. Simultaneously, we will continue with the clinical conditions related to these spaces. Several layers of deep fascia are there in the neck. The outermost layer is the investing layer, which covers the whole neck and includes the muscles within splitted layers. Inside this, covering the vertebrae and the muscles around the vertebra is the prevertebral layer of the deep fascia. We'll get deep fascia around the viscera, which includes the trachea, esophagus, thyroid gland, and it encloses all through the neck. And this anterior part is known as pretracheal, and the posterior part is known as buccopharyngeal fascia. All these are single in number, but either side the great vessels and nerves are enclosed in two vertically arranged sheets of connective tissue. This is called carotid sheath. So this carotid sheath lies on either side posterolateral to the visceral fascia. Let us summarize the whole neck from outside. This outside is the skin, inside that is the platysma containing superficial fascia. Inside that we will get the deep fascia. So this is the investing layer covering the outer part and encloses the sternocleidomastoid muscle as well as the trapezius muscle. Inside that, covering the cervical vertebrae and the muscles around is the prevertebral layer of deep cervical fascia, and it continues anteriorly, and in front of the vertebrae it splits into two to enclose a space, the posterior layer, and this red line is the anterior layer. In between there is a space. This space is shown in green color, and this is known as space between the two layers of the prevertebral fascia. The visceral layer encloses the thyroid gland, trachea, and the esophagus. The anterior part is known as pretracheal fascia that encloses the thyroid gland, also the anterior part of the trachea. And posteriorly, the dotted red line showing the buccopharyngeal fascia. It's a part of the visceral fascia too, and it covers the posterior part of the esophagus. Behind this buccopharyngeal fascia layer, a space is there. This is known as retropharyngeal space. This splitted anterior layer of the prevertebral fascia, the layer is also known as alar layer, and the space between this behind the alar layer is known as the alar space or danger space. The fascia of the cervical region, means the deep fascia of the neck, are dense connective tissue, and there is potential space above and below the hyoid bone. This potential space lies within the splitted layer of one type of fascia or between two layers of the fascia, and it contains loose connective tissue. So it has connection with each other and also with the axilla and the the thorax. So this is the potential space through which infections can spread, and also any pus or other fluid can move from one place to another, or to the axilla or to the thorax. These are the deep fascia. You can see this is there are the spaces, potential spaces visible between the layers. For better understanding and for the clinical correlation, the spaces around the pharynx is divided into peripharyngeal space and intrapharyngeal space. Peripharyngeal space, this may be entered to the pharynx. There are two in number, two types actually, submandibular space and submental space. The lateral to the pharynx, the space is known as parapharyngeal space, and posterior to the pharynx is retropharyngeal space. If we look into the intrapharyngeal space, we will find that these lies between the constrictor muscle and the pharyngeal mucosa. So in this plane, if there is an infection that remains restricted to the space, or it can spread to the retropharyngeal or parapharyngeal spaces. You can see this is the horizontal section just above the level of the tongue, and we can see various spaces stained light green. This level 1 is the parapharyngeal, remaining by the side of the pharynx, and it continues, you can see the figure, it continues with the retropharyngeal space, and it is restricted to the suprahyoid region only. The labeling showing the retropharyngeal space, and it is behind the pharynx and anterior to the prevertebral fascia, and this form extends from the base of the skull and it goes downwards to the posterior mediastinum of the thorax. The investing layer above the hyoid bone splits to enclose the submandibular glands, and the superficial layer remains attached to the base of the mandible, and the deeper layer is attached to the mylohyoid line, and this layer encloses the submandibular gland. Posteriorly, it extends to splitted layer, passes deep and superficial to the parotid gland and enclose this. You can see in the figure the tongue and the submandibular gland, and the stained area is the space in the submandibular fascial region. So this area, if infected, is known as Ludwig's angina, and often it is developed from the spreading of the infected root area of the tooth. You can see in the second figure, this is a wide area around the submandibular gland. This area is affected by the infection, and that infection is named like this. Peritonsillar space is another important space. This is one type of intrapharyngeal space, and this lies around the palatine tonsil, and it is between the two pillars of fauces, means palatoglossal and palatopharyngeal arches. This space has connection with the other part of the interpharyngeal space as well as parapharyngeal space. So infection of this region can easily spread to these spaces. Another small space is just above the jugular notch, and it is also known as space of Barnes, and it is between the two layers of the investing layer, which splits just above the jugular notch and is attached to the anterior and posterior margin of the manubrium sternum. This area is small in size but contains the lower part of the hairs of the sternocleidomastoid muscles, and a small vein sometimes connects the anterior jugular veins in the inferior part. A small lymph nodes are there, and intraclavicular ligament lies within this space. Thank you very much for remaining with this presentation.